My name is Dr. Salem from Brooklyn, New York. Today I want to speak to you. I want to show presentation with the case from my clinic on breathing exercises, the proper breathing. The right way to breathe is the relaxed diaphragmatic abdominal breathing, which I want to show you now. Usually, guys, please get tested. Get yourself tested, especially after a certain age. But I will say all the ages, even at children. I get people at junior high school age, college age, with hypoxia. When you work out, resting, when at rest, the oxygen is normal. But when you put them to any physical activity, just as simple as walking, especially walking at the speed of like 3 miles per hour, they get hypoxic. And the reason for this is simple. The build up bad breathing habit. People build up bad habits, bad sleeping habits, bad eating habits, bad bathroom habits, bad driving habits. The same. People build up bad breathing habits. So we need to build up the right breathing habit. The bad breathing habit when you breathe in thorax, not in not diaphragmatic breathing. When you're resting, the main muscle of respiration is our diaphragm. Diaphragm is a big muscle that separates between the chest and the abdomen, and diaphragm is like that, two capillaries like this. When you inhale, diaphragm contracts, goes down, push the abdominal viscera down, okay? And when you exhale, diaphragm goes up. When you inhale, diaphragm goes down to increase the vertical dimension of the chest to the lung, to inflate, to create negative pressure inside your chest, so the air go into your lung to ventilate. It's called ventilation. Okay, when diaphragm goes down in the belly, it has a lot of functions, more than you think, guys. Diaphragm, when it comes down, pushing the abdominal viscera down, number one, it is one of the main drives that keep the intestinal and the gastric peristalsis, which is the normal inherited movement that digest food and make the gastrointestinal process of digestion and absorption of food. Number one is, as you said, when the diaphragm goes down, it pushes the abdominal viscera down. There's a big drive, a big motor, a big engine that keep the intestinal or the gastrointestinal peristalsis for digestion and absorption. So it's not the only one. The other one is when the diaphragm goes down, it pumps the lymph. We have a lymph pump. The lymph comes, the waste from your food, the toxins from the food, it goes to we have a lymph system, and lymph nodes, get absorbed there, so the lymph pump to pump the lymph up to the thoracic duct, okay, is also being enhanced or being, I said, driven by the diaphragmatic abdominal breathing. Okay, not only that, look at me, when diaphragm here, what sits on top of the diaphragm? Sits on top of the diaphragm is the sternum. The mediastinum has a heart. When the diaphragm goes down, it pulls the mediastinum, it pulls the heart, it will get the heart a little bit, and when the heart get a little pulled with the mediastinum down with the diaphragm, it pulls on the aorta, pulls on the carotid arteries. It helps also with the aorta and carotid goes to the brain. It helps also with the pump of the cerebrospinal fluid, which is a fluid that nourishes and protects your brain and spinal cord and central nervous system. So diaphragmatic breathing is crucial, is important. Trust me, if you have a diaphragm spasm, you can get a back pain. Diaphragm spasm can be one of the causes of back pain. If you have diaphragm spasm, I spoke before, guys, diaphragm is a barrier between your chest and abdomen. It attaches from the xiphoid here, from the front, from the ribs, all the sides, go all the way down to your back from the front. It's a big barrier between your chest and abdomen. So diaphragm is a transverse barrier, but the major vessels, major arteries, major veins, major nerves, it runs longitudinal in your body, runs longitudinal. So there is holes, openings in the diaphragm for the major vessels, major nerves, major arteries, veins, a lymph vessel, for the esophagus. When diaphragm spasms, like any muscle, diaphragm is a big muscle, it's a muscle. When it spasms, it constricts the openings, so it becomes narrow. So the veins and vessels, veins, arteries, and lymph and viscera will not function properly. So you need to relax the diaphragm. When you relax the diaphragm, then the openings get widened and the function gets better. The flow of the fluids, it gets better and gets normalized. That's why it's very important to examine. Any back pain come to you patient, any back pain patient, please examine the diaphragm. How to go to examine the diaphragm? If I press here, it's tender, this diaphragm is spasm. Is it tender? It hurts when I press. This is diaphragm spasm. Is it tender? Okay. This point, when this point is tender, guys, it tells me that the rib 6 to 8 anteriorly have malfunction. And to treat this is not the goal of this video today, but because I want to teach you something, guys. Okay, to treat this, just passively flex the patient up all the way and keep him for 90 seconds to 2 minutes, and bring him back passively. This pain will be gone, disappear to gone. If you want to treat this, you turn the patient to one side and the side bent, and this pain will be better. And bring it back. Why I'm telling you this? Diaphragm, as we said, diaphragm, let's say the body has 4 aspects. Our body has 4 aspects. Anterior aspect, this is our wall. We have lateral right aspect, we have left lateral aspect, we have the posterior aspect. Diaphragm attaches between these 4 aspects like this. Diaphragm in the middle. Okay, if diaphragm gets spasmed, based on the counterstring theory, you shorten the muscle to relax. If the muscle already spasmed, if you want to relax it, we have 2 ways: to stretch it or shorten it. The counterstring theory is to shorten the muscle, and it works much easier. It works much easier. Counterstring technique was found by Lawrence Jones 120 years ago, and multiple researches are done on counterstring, and it's standardized in American osteopathic medical schools, both the government schools or the private schools. So it's already well known with more than 120 years of research. Dr. Lawrence Jones did 50 years of research on his technique. So, okay, how this works, shortening the muscle, gets a result 100% in the patient who can relax. If the patient can relax while doing the technique, passive technique, you get 100% improvement. What is the 100% improvement? Based on Lawrence Jones, if you get 70% improvement, decrease in the pain, you achieved the goal. Okay, how Lawrence Jones works, guys? Okay, we spoke about, let's say about the diaphragm now. The diaphragm attaches between the 4 aspects. So if you shorten any of those 4 aspects, the diaphragm, you're gonna shorten the diaphragm. Let us say, I don't want to make you confused, guys. The goal is to shorten the muscle, shorten the diaphragm. And we have here 3 scholars who spoke about how to shorten the diaphragm. Lawrence Jones was the oldest one, 120 years ago. Then came John Bledger. John Bledger was a big guy who developed the medicine in the whole world and in the West. Funny that one of the young physical therapists left a comment in one of my YouTube videos speaking about John Bledger, telling me that John Bledger has no citation. John Bledger was the head of Michigan State research team, was a head of Michigan State University scientific research team. He was the dean of Michigan Medical School. He make it rank number 20 from ranking medical schools in America. He's a great guy. The National Institute of Health wrote 3 pages in 1973 about John Bledger and his researches and his participation and contribution and development of medicine. The John Bledger, second one. The third one is Jaya Mateu. Jaya Mateu, she had a PhD in physical therapy. She's from Connecticut, New York. She developed an institute, 3-year program, diploma in manual therapy. She did a wonderful job. Let's speak now how Lawrence Jones, what's the difference between all the 3 of them. Okay, John Bledger is an easy way, is you press from here and you press from the back. Based on a body build, John Bledger suggested you put 3 pounds pressure here, 3 pounds pressure here. When you press like that, you make the anterior aspect and posterior aspect of the body closer, a little bit. You do this, then you shorten the diaphragm. What happens when you do this? The holes, the diaphragm will relax, the holes here will widen. If you have a mesh with holes is tight when the mesh is tight. When you relax the mesh, the holes widen. This for John Bledger technique. Okay, let's go again to this John Bledger from anterior posterior. If you want to relax the respiratory diaphragm with general pleasure technique, you press from the front and back. If you want to relax from the side, the two people who spoke from the side are Lawrence Jones and Jaya Mateu. And the guys, what I like about it, Jaya Mateu said, if you want to do my technique, do Lawrence Jones first, then do mine. Because my technique is called, she named her technique Advanced Counterstring. Because the real counterstring, the original counterstring, was found by Lawrence Jones. Jaya said, if you want to do my technique, if you want to do Jaya Mateu technique, do Lawrence Jones first, then do mine. Okay, this is a respect for scholars, guys. Our scientists, our scholars respect each other. That's why we need to respect them, and we need to respect ourselves as well. Okay, what Lawrence Jones said. Lawrence Jones said, let's talk about the lateral side. Lawrence Jones said, if you side bend the body, now I'm shortening this side. You're relaxing the diaphragm in this side. And if you side bend the other side, you shorten the diaphragm in this side, then you relax it this side. This is what Lawrence Jones said. I'm going to try Lawrence Jones now with you guys so you can understand it. Okay, line your left side. I'm going to treat this side. My brother here is the father of one of the students who trained with me in the clinic, and he doesn't mind me filming or video or everything. That's great. Thank you for the sharing, for allowing us. And okay, let's relax, please. Fully relax. Get the camera here and treat this. Okay, now I'm lifting here this. Now I'm treating this right side diaphragm, and was tender before. This technique is Lawrence Jones technique, okay? And if I press a little bit here, how is the pain now here? Is a little better or the same or gone?
It's okay.
Pain gone.
Yeah.
No more pain. No more pain here. Okay, guys, this was tender. The right diaphragm was tender. As soon as I raised the patient, the diaphragm tenderness disappeared. Okay, based on Lawrence Jones said that if every counterstring technique should stay 90 seconds, but except the reps technique stay 2 minutes. Okay, there's a new research that came up. Jaya Mateu said that counterstring you need to do from 1 minute to 5 minutes. And why she said that, she said chronic pain, it changes the nervous system a little bit, the function of the nervous system, and you need to do more time. And Jaya Mateu said that, it's not only the muscle. She said that the skin has tone, the fascia has a tone as well. So you need 90 seconds to relax the diaphragm, the muscle, but you need more time for the fascia as well. So suggest if you have a chronic pain, stay up to 5 minutes. Young physical therapist around 2010. Jaya Mateu was around 2002. She found a technique 2002. In 2010, young physical therapists, Brian and others, they found that counterstring technique can get help. You can give help even if you do 30 seconds. So with my experience, it depends on you and your patient and circumstances. The patient cannot tolerate. If he can tolerate, better to stay the longer duration. Patient cannot tolerate or uncomfortable, whatever, you can do also like 30 seconds. But of course, I agree with Jaya Mateu that the tissue and fascia has tone. And with people with a chronic pain, they have so many changes in their nervous system, and they need longer duration for the nervous system to adapt. It doesn't adapt, doesn't react quickly. So how is the pain now, my brother here?
Okay.
It's good, better now?
Yeah.
Thank you. You do this, and if I want to help him a little more, I should move him a little up, tiny bit, and I'm gonna go back down. Okay, this is for Lawrence Jones technique. Just relax, don't worry at all, don't worry about rubbing it. Okay, how is the pain here now when I press?
Okay.
It's better, it's gone. Yeah. See now we did the technique,
Yeah.
is better. Turn now your back fin. Turn it out. Other side. Yeah, we need to do the other side, will be the other side. When I do the other side, will be the other side. But before I do the other side, let me do the front. How is the pain here?
It's okay.
It hurts so better.
Better.
Okay, this is based on Lawrence Jones. If they have tenderness in here, based on Lawrence Jones, those are ribs 6 to 8 anteriorly, they malfunction. And to treat it, patient lies supine straight and you take it up. We can do that now. It's better now, yeah?
Yeah.
But got better after we treated this diaphragm on the right side. How is this here?
It's okay too.
It's better?
Better, yeah.
It's better. See now, it's better on the other side as well. When you work with counterstring, guys, you get a lot of results. The last patient I showed you, go for the previous video. The last spoke about the anterior lumbar spine, and I saw a patient that doesn't want to allow his picture to come. Go for the video, speaks about anterior lumbar spine pain and how to treat with Counterstring. The patient came in with a lot of abdominal pain. He came with back pain but has tenderness all over. The diaphragm, the stomach, everywhere. All the was messed up. I treated him with left side anterior lumbar spine, and believe it or not, his diaphragm tenderness improved, his all abdominal muscles improved. Why I'm saying this? Focus here, guys. Diaphragm, where is the, or what is the origin and what's the insertion of diaphragm as a muscle? Diaphragm originates from the transverse process of the thoracic spine and lumbar spine, from the body of the vertebrae of the thoracic spine and upper lumbar spine as well, from the ribs. So diaphragm interlace with so many muscles during its pathway. It interlaces with the quadriceps lumborum, interlace with the psoas muscle. So any of these muscles that interlacing together, I mean like in their course from origin to their insertion, they interlace the pull like this. If one is spasm, pull the other with it because they're meeting. They're going like wires. One is going this way, another one going this way, and a third is going this way. So if one of those muscles, psoas, quadriceps lumborum, diaphragm, and others, is one and going to spasm, we're going to pull the other with it. Goes spasm. If you relax one, you may relax all of them. Okay, now I'm going to show you the breathing. Take a deep breath. Okay, get it closer, please. I'm going to put one hand in the abdomen, one hand in the thorax. The goal is only the one hand in the abdomen should move. Yes. See, he's very intelligent, smart. You got it right away. Believe it or not, I get a lot of patients with hypoxia. I'm going to tell you, please, we're going to come another talk on hypoxia. Just keep tuning. See, my brother now doing the right breathing. It took him only a few minutes. Don't move your chest, only belly. And do inhale. No. Inhale, belly go up. Exhale. Inhale. Exhale. Don't move your chest at all. Not at all. With inhalation, exhalation, only belly move. Inhale. Exhale. Inhale. Look at this now. When inhales, belly moves. It means the stomach goes down. The viscera goes down and goes up, down and up. This, guys, you cannot have normal motility in the digestive system, the intestine, and the colon, and the stomach. The inherited movement is called motility. No normal motility without normal mobility. Mobility means they should be mobile and free, moving each other, moving in its space. If there is no good mobility, there is no good motility. You got me, guys? So mobility is necessary. How? See, look at diaphragm. When you breathe with diaphragm, you're mobilizing your viscera, the rate of your breathing. If you breathe 1 times a minute, you're mobilizing your stomach, you're mobilizing your colon, you're mobilizing your intestine. Okay, when you breathe, inhale now, the stomach goes down. What goes under the stomach will be the pancreas. Pancreas 30 centimeters go under the stomach. The transverse colon go under the stomach. When the stomach goes down, it pushes the pancreas, pushes the colon to mobilize everything moving. Keep moving. When they keep moving, they get healthy. They function better. But if you stay stagnant, you breathe in your chest, no belly movement, you get messed up. You have to be sure that you do relaxed, diaphragmatic, abdominal breathing. Okay, now my brother did it very well. It's going to take training. Everybody build a bad habits. To break a habit, you need 2 weeks of conscious practicing. You need to practice this consciously 2 weeks. How are you going to do? You go to bed 10 to 15 minutes earlier. You put one hand in your belly, one hand across the chest. Talk to yourself in your head. I'm not going to move my neck. I'm not going to move my shoulders. I'm not going to move my chest. Only belly moves. Be sure when you inhale, belly gets bigger, hand go up. When you exhale, belly gets smaller, hand sinks down. It's very easy to practice this when you're lying down. It's harder when you're sitting. It's more hard when you're standing. It's harder when you're walking and working. So it takes some time to practice. Today we're going to fix this lying down. You practice at home. Try to practice sitting if you can. Next time I'm going to do with you the sitting and standing as well. Okay, guys. Now we learned now how important diaphragmatic breathing is, and I want to give you one thing to think about it to conclude with. Okay, the negative intrathoracic pressure diaphragm brings when you breathe, it helps suctioning the venous blood from the legs up to the heart. People think we have only one pump for the blood, which is the heart. We have 3 pumps, not one, we have 3. The primary is the heart pump the blood, go down with the gravity to the legs. What bring down, want to bring the blood back to the heart. Again, is the gravity, is the breathing. When you create long deep breath, when you breathe deeper, you create negative interthoracic. When the diaphragm goes down, it makes the vertical dimension of chest bigger. It helps suctioning the venous blood back to the heart. It's a secondary pump. The negative intrathoracic pressure in the chest created by the diaphragmatic abdominal breathing. The third pump is the muscles, the leg muscles, the muscle tone help also pump the venous blood back to the heart. When I speak about how important the muscle is, next another time about the string counterstring and how important the muscle. Muscle is helping your heart, is a secondary pump as we spoke to the heart. Have a good one. Subscribe to my channel, share the video. Any question, comments, write it down. Have a good one. Bye now.